It's very difficult to demonstrate the nerve supply and the arterial supply of the scalp because the soft tissues actually firmly bind with each other and it's very difficult to separate the planes. But still, we'll try to identify some of the few important blood vessels and nerves in the anterior part of the scalp. So again, we will reflect the scalp, and here we can identify one nerve. This is the auriculotemporal nerve. This is the cut end of the auriculotemporal nerve which supplies the anterior part of the scalp. Then the area in front of this will be supplied by the temporal branch of facial nerve, which will supply the frontal belly of occipitofrontalis muscle. Then further medially we have the zygomaticotemporal nerve, the supraorbital nerve, and the supratrochlear nerve. So the only nerve we could identify is the auriculotemporal nerve. This is the auriculotemporal nerve, which comes as a branch from the posterior division of mandibular nerve. Then, if you observe here, this is the supraorbital nerve. How to differentiate between the supraorbital nerve and the supratrochlear? The supraorbital nerves are usually large and they are lateral to the supratrochlear nerve, which lie medially. Apart from this, we can identify these important blood vessels. What are these blood vessels? This is the superficial temporal artery and this is the superficial temporal vein. So these are the superficial temporal vessels which are visible from the anterior part of the scalp. Again, dissecting the supratrochlear artery, supraorbital artery is really challenging. Once we demonstrate these two arteries, we will complete the dissection of the anterior part of the scalp.